4 general areas, but they drilled it down into 6 to make it a little bit clearer. The first thing the Act will allow us to support public health response that will fund COVID-19 mitigation efforts, medical expenses, behavioral health care, and certain public health and safety staff. So, for instance, our vaccination effort, money to go toward providing for additional vaccination sites or effort, public vaccination drives or what have you. It will help with, unfortunately, during this pandemic, behavioral health, mental health issues have arisen that no one could have anticipated. Domestic violence has increased, I think, by more than 15% over the past year and a half, as people were stressed out of either being without work or having to work from home. There's provisions in here, as I'll get into, in dealing with substance abuse. And then obviously the impact that this has had on our public health workers, whether they be our health department, our clinic, healthcare staff, our EMS, our dispatch, people that are involved in the public health response. I specifically stated just a minute ago this would help replace public sector revenue loss. Many local governments lost revenue during this period of time. There's pages and pages about how that can be calculated. I'm going to say this again, though, this is not for local governments just to decide they're going to drop their tax rate and backfill with this. That's not what this is for. This will help fund water and sewer infrastructure projects. And in that regard as well, it will help with broadband infrastructure. I'll speak to that just a little bit separately. This will can help address negative economic impacts, respond to economic harm to workers, families, small businesses, impacted industries in the public sector. And then one area I think that's really of interest to a lot of people is allowing for premium pay for essential workers. And we'll talk about those, who they define as essential workers. Offer additional support to those who have and bear the greatest health risks in this pandemic because of their service in critical infrastructure sectors. So these are the broad categories that the Act will allow. Page 2 is more information for me and for our board. I have a deadline pending within a few days of recording. There's quite a few requirements on the local government. This is in the interest of transparency and accountability for reporting back to the federal government. August 31st, I'll be having to do my first annual report. It's basically, what have we spent the money on so far? Well, that's going to be an easy report for me because all the money's sitting in the bank. Okay, so we did not want to spend one dime until the board could be fully apprised on what this is allowed, what's allowed. And then Graham County, because we will have gotten less than $5 million, and we obviously got less than 50,000 people in our population, will be required to do a report on October 31st this year, and then every year thereafter through the end of this cycle. So that's more for our board to manage. Page 3 is just some more information related to how we deal with the money. There are some things that the county can spend this money on that's within the purview of these areas that I just discussed. However, the federal government does recognize that there's going to be some administrative costs to this, to dealing with this money. The county could hire consultants. I just want that out on my table if they choose to help us determine what the highest and best use of these funds are, and to help with managing the money. And it also allows us to use what we call our indirect cost allocations toward the administration. So what that means is we have specific functions and roles in this county that everybody's part of the organism. So with federal funds, we can pull down or use money toward things like grounds maintenance, and it would get applied to grant funds across the county. This would allow for, since I'll be doing most of the compliance and the administrative work with this would allow for us to take part of my salary as use of the money, because I'm doing all the paperwork and the administration. I would not advocate for that, because the way I look at it, that's just part of my job. And I would want the county to get the best use out of the funds. And to me, using part of my salary as part of the pull down of the funds is not the highest and best use, because I'm doing this stuff anyway. But that would be allowable under the grant. One thing I do want us to make note of, that there's a difference in the CARES Act and ARPA, what I call ARPA money, in that counties receive CARES Act money directly, just like the ARPA. However, under the CARES Act, the county was obligated, because we got our money from the state, and we were happy to do so, the county was obligated to do a revenue share with our towns. And so we were able to help our towns pay for PPE and pay for COVID pay when their staff got sick or were out on quarantine. And also help with telecommuting and costs like that. And under this act, counties receive their allocation directly from the federal government, and then the state will be getting an allocation that they will share directly through their allocations with the towns. So, and I don't like this term, but they call municipalities that are under certain population thresholds, which all of our towns here in this county are, obviously. They call them non-entitlement units, or NEUs. So the NEUs, or the towns, should be hearing from the League of Municipalities very soon, I would think, or quickly thereafter, following the allocations of the state, and then the General Assembly will do their allocations to the towns. That's not to say that the county cannot do revenue sharing with the towns. It's not a preventative thing. So if the towns were to come and say, we need to enhance our water and sewer, we've got some clean water issues, the county could treat that as a priority to do a revenue share with the towns directly. But there will be money coming from the state of North Carolina from various and sundry places that will also help address those issues. So our board may say, we're going to sit back and wait a little while. And this was the guidance that we were given by the state treasurer's office, is sit back on some of this stuff because there's more money coming from different pots of the ARP money. So, and this will come directly from different agencies within the state of North Carolina. So I did want to mention that. On page 4, you'll see some specific examples of how the county can support the public health response. I've listed those a little bit earlier, but you can see under the public health, you'll see mitigation and containment. In other words, for example, a vaccine incentive program, medical expenses, and this is a real interest to me right now, and I think it should be to all of us, risks presented by new variants and long-term effects of the virus. We're dealing with the Delta variant right now. The Lambda's coming. And from everything I'm reading, the Lambda could be worse than the Delta. So I think this medical expense issue is going to continue. Behavioral health care. Again, I mentioned mental health, substance abuse, and other behavioral health needs. Public health and safety staff, which is very important to the county because we have our EMS and dispatch who have been on the front lines. We have health and human services, which I'll get into in a few minutes, who have provided services who put themselves at risk as well. And then negative economic impacts. Assistance will come via, I think, state funding for workers and families, small business help, loans and grants, for small businesses, technical assistance, public sector. We had to furlough some staff a year and a half ago. And thankfully, I think pretty much everybody that was furloughed has been brought back, but this would allow, if we hadn't brought everybody back, to rehire staff. And then also to assist impacted industries such as tourism, travel, and hospitality. And the statute specifically dealt with tourism because a lot of tourist places were negatively impacted. Page 5, at the bottom of the page, you'll see provide equity-focused services for addressing health disparities. This will allow this funding to be used for community health workers and public benefit navigators. To give you an example, we have our paramedicine program. This could go toward helping that community health worker with maybe resources, or it could actually help with paying their salary. At this point, that person's salary, most of that person's salary is being paid out of a big endowment grant. However, that diminishes over time. And I mentioned community violence or domestic violence. This also can be used for housing and neighborhood services for folks who are either experiencing homelessness. One that was of interest to me was affordable housing development. We have our Rural Development Authority that money could be shifted toward. Housing vouchers, I think you'll see money passing through the state of North Carolina to programs like Foursquare, HUD, that type of thing. This doesn't mention it, but the statute states that money can be used toward weatherization and home repair. So some of our at-risk families that may need some help. And I was kind of scratching my head about that, but as I read the statute, I realized that they saw where there was a lot of spread within families, where families were living in overcrowded conditions. And so they felt like that this was something that needed to be dealt with. Educational disparities, I think we all saw that, with kids having to be home, being schooled from home via internet. We don't have good internet out here. How do we get kids the resources that they need in the event that school would have to be shut down again? This was a big priority. Expanded resources for high poverty school districts, which Grant County qualifies for that. I think you'll see money flowing through DPI, Department of Public Instruction, toward our school system on the whole. And then educational services like tutoring and after-school programs. That caught my eye too, because we had an after-school program at Dakota Valley Center for years and years. And I know one year that they did not get funded and they were not able to continue that program. And then promotion of healthy childhood environments, expanding child care, home visiting programs, and then one of particular interest that I think you'll see flowing through our Department of Social Services, services for child welfare, involved families, and foster youth. And then page 6, I'm just going to just briefly mention again, replacing office revenue. I don't see that as an issue for Grant County. Grant County was blessed this past year with record sales tax revenue, which enabled us to expand our services back to pre-pandemic levels in our budget. And so, you know, I don't think that'll even be an issue. The one that I think is of most interest is on page 7. I'm going to go through this pretty in depth because we've got several of our departments represented here today, and I'm glad to see that. Is public health and public safety employee payroll. Under the ARPA, these recovery funds may be used for payroll benefits, for public safety, public health, health care, human services, and other similar employees. The statute says that this payroll expansion can be used for any public employee who either deals with COVID-19 directly, as our EMS does, by being on the front lines, dealing with sick people, or any employees who have contact with the virus either through dealing with the public face-to-face or dealing, and this was interesting, dealing with touching anything that's been touched by the public. Paperwork. Custodial staff. And this is different than the CARES Act. The CARES Act was pretty specific that it had to be public health, public safety. Anybody else, we really had to make a reach to justify if we wanted to use CARES Act money to reimburse the county for salaries. CARES Act did not make any provision for enhancement of payroll. It basically said you get an employee that's sick, you can reimburse the county for their pay and their pension, but not their FICA tax. This says we can enhance the payroll. And where we're basically the same as CARES Act is anyone, we can say that anyone who's considered public health or public safety employees, we automatically can assume that they're 100% eligible, all of their time is 100% eligible for use of the money. Okay, that's a change. We had to fight with the state of North Carolina over our DSS employees because for the longest time the state would not look at social workers as being on the front lines, and so we could not reimburse the county for their wages for a good while. And if we did, we had to justify based on the time that they were spending. And then with the CARES Act also, I had to justify with EMS how many, for a while, how many hours were they actually on the truck. Finally, they said, no, it's going to be all 100%. This automatically assumes that our public health and our public safety are under this eligibility just by virtue of the fact that that's what their role is. Okay, that makes it easier for the county. And then also, they drill it down even further to say that any work performed by an employee of the state, local, or tribal government is considered on the front lines, essential. Which makes it a little bit simpler from an administrative perspective. Even though I would have to drill down like my DSS employees to say how many hours or what we're actually doing. Public health, public safety, it's automatic. Right? And then again, work involving, it says, what is essential work? It's work involving regular in-person interactions or regular physical handling of items that were also handled by others. And then they also go on to say a worker would not be engaged in essential work and accordingly may not receive premium pay for telework performed from a residence. So if you're working from home, you're not eligible. Premium pay also can be paid retroactively. Everything in this act says any expenditure from March 3rd forward except for premium pay. Premium pay, we can claw it back to January 27th, 2020. That's when they officially said we got the virus in this nation. Okay? So that would mean that the board could go back and say, okay, let's look at the hours that certain groups or employees were working from January 27th, 2020 forward, and we can back pay as part of that premium pay. It's up to the county. Counties have discretion to designate additional sectors. Additional reporting requirements include people who are considered higher wage workers or grants to third-party employees. If you go back up a little bit on the page, right under where it says premium pay for essential workers, counties may provide premium pay up to $13 an hour to eligible county employee workers performing essential work during an emergency or to provide grants to third-party employers. And what does that mean? If I've got a worker who is making $12 an hour, let's just say, there's the $12 an hour, the $13, up to the $13 can go on top of that 12 for that period of time or until the money runs out. Okay? Up to $13 an hour. Because you got to remember that Graham County, we got one of the lowest allocations in the state because we got one of the lowest populations, a little over $1.8 million to deal with. So the board's going to have to, there's going to have to be a lot of number crunching, in other words, to figure out how to make it all work for whatever groups or employees that the board were to designate to be eligible for this additional $13 an hour on top of what the regular pay rate is. We cannot backtrack and say, well, they got, they're getting paid 12 and we're going to continue paying them the 12. It has to be what they call premium pay. Okay? And we have to account for it with the federal government. So every time I do a payroll, whatever the board determines, then we're going to have to make sure that we're showing the federal government exactly who got paid, how, when, and for what reason. All right. Okay. Basically, if we weren't the local government, we would be looking at staffing in nursing homes, workers at farms, janitors, sanitation workers, truck drivers, transit staff, public health and safety, child care, and social services and human services. Which pretty well runs the gamut of Graham County local government. But they do say any work performed by an employee of the state, local, or tribal government is considered. One more item that they don't mention is that this pot of money is The theory behind it is that looking at disparate impacts to certain groups. And one of those certain groups is your low and moderate income. So they want it focused on your what you would call low and moderate income workers, with the requirement that you would concentrate the funding based on 150% of the average, the greater of the average salary of a worker in the state of North Carolina, or the average salary of a worker for the county. So I did that math. And the higher is the worker in the state of North Carolina, and 150% of that average is about $83,000 a year. So any worker that's making over that $83,000 a year, we would have to justify the premium paid to those folks. Okay? So, because they want the money concentrated in your low and moderate income earning group. So that's another hoop that we have to jump through. All right? And I know you've probably got more questions, but we'll just kind of jot them down and then we'll save those for the end. Broadband is a big issue. Now, this is one that I got excited about to begin with. I was real excited about it because we know that broadband is a big deal here in Grant County. Counties may invest recovery funds in broadband projects if you're not a county in the state of North Carolina. About 10, 12 years ago, the General Assembly passed a law that said that counties and municipalities cannot be internet service providers. So I thought, well, okay, I know that, but we could probably give, grants or whatever to the internet service providers, so they could expand our last mile. Okay, we could help leverage some money that they're going to be getting too. And I was really excited about that until Sunday afternoon when I was doing some more reading, and if you realize that I was reading this kind of stuff on a Sunday afternoon, I had no life. So I was reading in a blog from the UNC School of Government that also said that the statute says that not only can we not be ISPs, but the only way that a county government or a town government, local government in North Carolina, can make a grant to an ISP is if they do it out of unrestricted funds. It has to come out of the general fund. Therefore, this is restricted money. So ARPA money from the local level cannot be used to do grants for broadband, unless the General Assembly acts. And so I got Sophia busy with Region A, our Council of Government, and they're saying, well, they're talking about it down in Raleigh. So what will have to happen is, if that's to occur, is that the General Assembly of North Carolina is going to have to either amend their law and allow for restricted money to be used, or this is a no-go for counties. Now, my pea brain started thinking, well, maybe I could leverage money, because I'm saving money, like on this piece, because I'm using ARPA money here, that you might could come out of our budget, and then use that money toward broadband. But there's this thing in the federal code that says we will not supplant federal money with local money with federal. So I can't use federal grant money to backfill my own budget unless the statute says I can in specific cases. The statute's silent on that. And So broadband is probably not going to be a priority that the board can, at this point, identify as one of the things that we can spend this money on. If you look on page 9, we'll see ineligible expenses. Pension funds. At first you're saying, wait a minute, Becky said that we can use this to pay not only the premium pay, but the FICA and make contributions into our local government retirement system. We can't. This would be like if we owed the state of North Carolina for back pension money, which that's not going to happen. We can make big deposits in. We can't do that. We can't use it for debt service. I can't pay loans off with it. Okay? And like I said earlier, I can't use it to enhance my own fund balance. I can't use this as match money for other federal grants if the grant says I can't use federal dollars to match. Okay, so let's give you an example. We get a grant from the Appalachian Regional Commission. The grant says the match has to be local dollars only, in some way, shape, manner, or form, or state dollars only. I could not use ARPA money to match that grant. Okay, because most federal grants are feds put in 80% and then local dollars or state dollars put in the other 20%. And then, except for premium pay, I can't go back and recoup dollars that I spent for COVID activities out of the general fund from January 27th through March 3rd. Okay, except for premium pay. And then again, I can't tell the board, let's lower our property tax rate for 2 or 3 years because we got this pot of money. So those are the things I can't spend on. Page 10, you'll just see some of the expenditure categories that the board can opt through. This came straight out of the state or United States Treasury guidance, which addresses these main areas that I've listed. And I've highlighted some of the ones that I thought that perhaps our local government could help with. Obviously, the public health, we could do all of it. It'd be some good things to do. And I want to highlight the substance abuse services because we've got basically one program for peer support that's already at work, and I know that we've got our local drug coalition that's become very active in our community. And so some of the ARPA money could be designated toward helping with these two, either the peer support programs or some of the activities that the drug coalition has identified that could be done on the ground. Food programs, I know that's of interest, feeding our people. Now I said can't do broadband, but we could perhaps do some things to help make sure that the school children have what they need for internet, job training, aid to nonprofits, helping with our school system. Obviously, our premium pay is of great interest to a lot of us. So these are some things that they outlined on page 10 and 11. And then I just pulled out some pages out of the statute itself, page 12. I just highlighted those areas, those workers that they specifically identify that can be receive the premium pay. And then I also pulled on page 13 through 15 just some specific examples that NACO has outlined that will help the board figure out what priorities that the board wants to set for this money. And most of them I have outlined as I've stated. You'll notice again on page 14 in the premium pay, any work performed by an employee of the state, local, or tribal government is considered premium pay. But again, I want to say this: if health and safety are automatically assumed to be 100%, others we might have to look at what percentage of their time was spent doing these activities before you calculate their premium pay, if that's what you want to do. And then just to give you an example of how the state is going to be providing additional funding, on page 16. And Wanda can probably speak better to this than me, but when we had our home and community care block grant meeting last week, Region 8 of our Council of Governments said that there's going to be ARPA money flowing in addition to the HCCBG money that will allow us to enhance our senior services. And I asked Jeannie Matthews, who is works with Sarah Jane Melton, to send us a list. So these are all the list of the things that the board may want to consider as that money begins to flow, of expanding and enhancing programs for the senior citizen population. So that's the ARPA in a nutshell. I tried to, like I said, distill down about 250 pages of reading into these 15 pages. And I guess if it's appropriate to our chair, that we could field questions or comments at this point.
Please, anybody that has a public comment, you want to step up to the podium. Questions? Sure.
Good morning, I'm Pastor Eric Reese of the Methodist Church. I just want to say a big thank you. I don't have a question, but I will have later, but I just want to say a big thank you because you took 250 pages and helped me understand it. So thank you, God bless you.
Thank you. Anybody else have public comment or questions? Also, please make sure you sign up back there so we can recognize you as well. Anybody? You can do it after.
I just need it for the minutes to record.
Good morning.
So very interesting to hear everything you put together, Ricky. I looked at a few things just in the past couple of days when the meeting was posted, but I'm very interested and excited to work to see how this money can be allocated and how we can get our priorities together. So what are the plans for getting back together, public meetings or more workshops?
Consider that.
What I would like to see, this is just Betsy talking.
Sure.
Finance officer is, what I would like to see is for the board to be able to drill into the numbers of how it's going to look for, addressing our staffing first as well, and also looking at the substance abuse piece as well as what things we can do from helping our community, whether it be housing or whatever. I failed to mention one thing, and that is we have been contacted by the Dogwood Trust and the Manahava Trust because they know that we're gonna be getting money from various state organizations, as, you know, our state departments as well. And they want us to be able to use some of the ARPA money to leverage some money that they've got as well. So, I look at this as a process that I would hope the board just wouldn't say, okay, we're gonna let's just spend it all at one time, but let's address the most pressing needs first, maybe with this first tranche, and then look at how we can best leverage the second tranche. So that's just Becky. That's Becky's opinion.
Well, from the way it sounds and everything, as they have opened up the gates to try to allow for different things to be done, it sounds like we can do a lot in a lot of different areas. So it's always good when people can work together so we can get more done.
That's
So
right.
I'm excited for that.
That's right. This is a huge opportunity for Graham County and our nation as a whole. As the state treasurer said, this is totally unprecedented. Even going back to the New Deal, unprecedented. Of being able to, what us finance people call braid or leverage money. And because it's coming from so many different places, it gives us a lot of opportunity to do a lot of good things for our people.
Well, in the past, the Lord has done well and we've worked good together. So this is a huge opportunity with dollars that's not Graham County tax.
That's right.
It's great. So, yeah, any help we can get. So, thanks.
Absolutely. Thank you. Anybody else? Go ahead, Ms. White.
Good morning. For anybody here that doesn't know me, I'm Juanita Collins, the transit director. I came before you a couple of month ago, whatever, with CARES funds that I have that's like ARPA, but different. But for me, I would prefer that you allowed me to utilize the CARES funding that I have for what I requested then, get with Becky and set up a budget, and utilize what funding that would have went in case you did identify and decide to give it to transit workers, transit staff within frontline with what they did through the pandemic. Keep those funds and utilize it for the drug addiction or some of these other departments that needs it. I have the monies if you'll allow me and give me the authority to use them to give the incentives that Becky talked about earlier. Thank you.
Thank you.
Good morning. I'm already in Brown Lehman's, I'm associate director here in the county. Over the course of this pandemic that we've been working through, we've been able to keep a paramedic service 2 ambulances in the county operating. At times, that's very difficult because of people being out sick, people hurt, and they ain't there. The EMS has really stepped up and helped during this time. And there's not been no bonuses or no raises in the last 2 years for the EMS. And like Misty said, this looks like this is money that ain't gonna come out of taxpayers' money. Sure, the government eventually gets some money from taxpayers, but it's not all here in Graham County. It's coming from other sources. Just in the last 2 days, we've hauled over 7 COVID patients to the hospital. And once or twice, we've had to wait at the ER for over an hour before we can unload those patients because of so many people being sick. This is direct contact with these COVID patients. These are patients that was actually sick. They wasn't the ones that just called for the ride to try to get in early or ahead of anybody else that's there. Like the ambulance gets abused like that several times. These are actual Graham County residents that are sick and needing assistance. And this would be a good time to offer bonuses back and subsidize maybe their pay with some of it, since they have stepped up and worked extra hours. They've been so of my employees has worked over 3,000 some hours in the last 2 years. And they get 1 year of retirement. And the year of retirement is averaged out to 2,080 hours of year of service for a 40-hour week. And these guys and gals are working over 3,000 hours a year. So I appreciate it if you look at that and try to do something for them with some of this money. Thank you.
Thank you. Absolutely. Anybody else?
Good morning. I'm Wanda Hill from the Grand County Senior Center Director. Nervous, I hate public speaking. But I just want to give you a little update about what's been going on with the Senior Center during this pandemic. And the ARPA funds that we're going to get is going to be separate and apart. We cannot use them for the premium pay. It's going to be used only on senior services. March 16th, we closed the Senior Center to activities and in-house meals for their safety. We began delivering meals to the participants' homes by the way of Meals on Wheels. Our Meals on Wheels clients upped the services we had to provide up. Breakfast meals were added to all the meal deliveries. We sent probably 2 boxes of shelf-stable meals per client home with them, with everybody, every client. We sent them bags of fresh vegetables. At Christmas, instead of their Christmas party, they got food and essential goods, toilet paper like everybody else had to have. Our staffing went down just after COVID began. We were at 3 full-time employees and 1 part-time kitchen aide. Some of it was for medical reasons. We had an 89-year-old county employee that took a layoff, and she eventually retired. We lost kitchen cleaning staff because of budget cuts. State of Franklin workers we sent home. The gratitude that I have for my staff that has worked during this difficult pandemic is unmeasurable. They take lots of pride in their jobs, and they show mercy and grace to the people that they serve. Many thanks go to Harold Millsaps, Tim Livewell, Ronnie Williams, Kim Christ, and Hope Anderson, and the transit staff for delivering meals whenever their schedule allowed. I also wish to thank County Manager Marino and the Board of Commissioners for the approval of hiring vacant staff positions and let me create a new position as a ship coordinator. During COVID, we also had to maintain our Senior Center of Excellence, which is SCOPE, Senior Center Operation and Program Evaluations. This is separate and apart from meal service. In closing, I want you guys to know that in 15.5 months, my employees have served and or cooked 57,231 meals. I respectfully ask the Board of Commissioners for the employees of the Graham County Senior Center to be recognized as a class of essential employees and be awarded benefits of ARPA 2021. Thank you.
Thank you.
Hello, I'm Bob Keeber, paramedic with the county. Wanted to let you guys know, we were on the front lines before the vaccines came out. We were hauling these patients, praying they weren't dying, and we were doing everything we could while they struggled to breathe in the back of those ambulances. Then praying we didn't bring it home to our families. Okay? We showed up every shift. We worked through it until the health department told us, no, you're positive, you gotta go quarantine. We'd say our quarantine, then we came back and did it again. Okay? We hear all the other counties about how their EMS, their fire department, their health departments got these bonuses back at Christmas to help them out. We got nothing. Kind of really put a hurting on the morale of EMS. And when I hurt my arm, I was lucky enough to have my dispatcher experience. I could slide into dispatch and help them out. The stress on them is unbelievable. Listening to somebody calling for help who can't breathe, getting one word out, help me, I can't breathe, and then hanging up the phone because they can't talk. Please support your lower end workers. You've heard from the bosses. I'm one of the workers. But please help us out. Help morale, because from the lower employees, it's in the pits right now, countywide. Thank you.
Thank you. Anybody else?
Speaking of, introduce myself. I'm the senior 911 director, and I've had the benefit of the block for the past few months. I hate that he was injured, but he has been trying to save the grace to get factor. But here in the time, actually before the time of the pandemic hit, we went through a period where we lost about half of our dispatch staff, and working together and getting new staff hired, we got to a point where I could say I was fully staffed at a few of our staff meetings. That was very proud moment. But again, just like Bob said, we lose these staff. There's competing counties and competing pay, and it is a tough problem. Right now, I'm almost down to half staff again, which is why a lot of these so important to me. But we have applications, taking applications now. So I'm very excited about trying to get to use some of this money to give incentives, to create priorities, and to increase that morale. Because it's, like Bob said, it's really low, and this is going to help out a whole lot. Very excited for it.
Thank you. Anybody else? I do want to express from the manager's seat that I can tell you thank you, especially to all the frontline workers. Probably that's not enough because of what you guys go through. I worked with you guys through the whole pandemic as well. I saw remarkable work being done in this county taking care of our citizens. So I'm hoping that you know, if I can say this here, and I'm including transit, I saw them, the senior center, and especially the 911 communications and Larry's staff. I'm aware of what you guys do. And I said this in a meeting over in the county one day. We've heard the citizens of this county. And I just want to say that you guys have come up a lot in several meetings in the past. And just know we're going to work hard to try to do things that we can, whatever we can fiscally for you. I just want you to know thank you from my seat for sure.
I have one more thing I need to say that I forgot to say. On that premium pay. Okay, I want to go back through that. Premium pay is up to $13 an hour with a max of $25,000. And I forgot that, and that's really important for those of you that could be eligible for this premium pay to remember. And in no way does it reflect the level of effort. It doesn't even begin, in my mind, to begin that conversation. But just remember that we are hamstrung by that ceiling, okay? And I was doing a little math while you guys were talking, and just so the board knows this, the median number of hours that, I just pulled EMS, the EMS worked from January 27th through the end of July was for that period of time was almost 4,700 hours. That calculates basically being into like 313 hours a month at just the EMS. That just gives you just a thumbnail look at the level of effort that our public safety. I haven't pulled the data on the police or the sheriff's office, but that just gives you a thumbnail of the number of hours that's been extended per county.
You were all good.
Did you have something you were saying? No?
No.
All right. Yeah, Commissioner Heller, if, before we go into New Orleans, did you guys want to discuss any more on the ones, or we do one more?
Well, we're gonna just have to figure out how to divide it up the best we can. I mean, we're to do the most good in the most places. Our EMS workers definitely need to have anybody that's out on front. The other. I don't think we can make a decision exactly how it's all gonna get divided up right now.
I would agree with that. We're probably going to sit down with the.
Since I've been out of work, it's the first, I've got to look at it again.
I'll sit
I
down.
need to comment.
Sure.
I want to highlight what Becky had mentioned about not jumping the gun and putting pressure on the commissioners, like, how are you gonna spend it, how are you gonna spend it, how are you gonna spend it? Because, keep in mind, we don't know what the state is gonna do yet. So, what we don't wanna do is decide to spend money a certain way and restrict it in that way, and then have the state tell us, oh, well, we have money for that. Because now we can't use the money from the state for that because we've already restricted it. So just as an example, let's say we were going to spend $1,000 on internet, and I'm using that because the internet obviously can't do that. And the state calls us after we've already encumbered that money and says, well, if y'all want, we got $1,000 for you for internet. Well, we already spent the money. And that $1,000 could have been used to help EMS or help the schools or help our seniors. So be real mindful and think about how this money could be spent. Be mindful of the other things in the community where there are needs. Like I said, we've got EMS, but we've also got our kids, we've got our seniors to think about. And support our commissioners and help them think through how to split that pie up while we wait on the state legislature to tell us what they're going to do. So just please keep that in mind.
Yeah, thank you. It's important to note that there's a lot of different branches that we have to deal with, a lot of different pots of money, and along with, as everybody knows, dealing with any kind of government, whether it's local, state, or federal, there's a lot of reading, as Ms. Garland showed you, and a lot of red tape and a lot of paperwork. And we are a small admin office, but I'll get with the commissioners, and me and Ms. Garland will work on how we can allocate and see where we can put this money, and then we'll try to do some presentations to the commissioners. Ms. Garland, would it be too much to say we could come up with something for the next commissioner meeting?
I've got some scenarios I've already been working on.
We'll try to come up with something before the next commissioners meeting to present to the commissioners. And now there's no guarantee they'll approve it at that point, but that gives them a base to start their conversations on how they want to see this go. Anything else? Any other questions, concerns, comments?
If we're needed for any of that work, I will be excited to be,
Absolutely.
help out in any way.
And I would encourage all department heads to schedule some time to sit down with me and Ms. Garland, if you want to. To the best of our ability, we have an open door, but as you know, there's a lot of things going on in our small little office. But absolutely, 100% would entertain that for sure. Anything else? I'll wait on Commissioner Eller to come back in before we start some business. There's some stuff coming up about and Ms. Garland's going to have to help me a little bit on the Old Long Creek dump site. Atoll dump site. There's another issue came up with that. We'll go over that as soon as Commissioner Eller comes back in. All right, well, we can go over this and we have to table it for the next time where you guys can talk about it. If you'll notice, there is a package that's got a larger sheet printout map of our Atoll dump. It's been requested that we put in, it looks like, from what I can tell from this, and I give you the narrative I think from ESCO, who is our regulatory company that we work with. It's been requested to put in 3 more monitoring wells for that Atoll property. And of course, they want us to sign, I gave you the paperwork, sign with the approval that they can get access, working with the U.S. Forest Service to be able to get access to these wells. If there's any questions on, I think, Ms. Garland, there was an issue with cobalt.
Yeah.
I think.
Yeah, Commissioner Wiggins and I, this was pre-pandemic. I always say big city and A city, before COVID and after COVID. But pre-pandemic in September, October 19, we got our annual water quality survey done, and it showed cobalt levels. MESCO, our contractor, was hopeful that it was naturally occurring cobalt. The state didn't look at it that way. We had quite a lively conversation with the state in Asheville on Thursday afternoon. And their directive at that point was continue to monitor. Well, about a year, a little over a year went by because nobody could come out and monitor. I guess probably 3 months ago they came back out, they did another sample of cobalt again. And so the state is wanting us to put additional monitoring wells down gradient to where the wells are now so they can see how far that cobalt has traveled. And this is where this is at. I think from what Manager Marino spoke to me about, the first step in that is then the application with the Forest Service for permission and access to drill the well or wells. And
specifically wanted to bring it to the board's attention because again, this is from what I understand in the past, this is a cost that county will incur. It is our own dump site, so we will incur the cost of these 3 wells. And I want to make sure the board was aware, and also we want to get the acting chair to sign, or would you like for me to sign your step if in fact you agree going forward with allowing? So yeah. You got any communication from water quality people?
we got a letter back in April saying, where's your monitoring? And then I think Jason and I and Mesco had a phone call following the monitoring. So the person that we were corresponding with, that Christine, whatever her name was.
We have a letter from water quality saying that you're going to have to deal with more wells.
Not at this point, I don't think.
That was my question. I'll leave it as I'm wondering how they can force us to do that, without that kind of. But we talked about the issue concerning this, and it's one of those processes that the federal government is slow on getting back to the information. So maybe we need to dig a little bit deeper into what the requirement is for those.
This letter that's from Jay Zimmerman.
Jay Zimmerman, yeah.
says, we believe that DWM will insist on the additional wells. I'd like to see that letter of him existing before we commit to spend money, say, shall. Thousands of dollars to put more wells there.
That was our wells.
Really?
There have been a couple of them already. We have how many? 4, 3? We have 36. At least 3 on this map. So we'll, again, that's why I wanted to bring this up to you. I was a little bit concerned about somebody forcing us to do something without, obviously, it's our dump and we have to monitor it. I'd rather look into it a little bit.
We followed all the bonds that they had presented to us when they closed.
Can I make a note? Just to have in mind, the EPA recently got a lot of money for water quality as far as, I don't know if it was CARES or ARPA, but there is significant amounts of grant funding on deck to address things of that nature, so I can look into that when you guys are considering that.
Thank you. All right, we'll dig a little bit deeper. If needed, I can pull more, if I can get some information as soon as possible.
We've got PSS meeting next Tuesday.
We can do it there as well. The next one is, there's 3 proposals that you'll see on your table, starting with the lowest to the highest. These are representative of, when we first bought our buildings, I went with Kirby Buildings, who provides their foundation structural design, the footers, the slab. And when we went, obviously, with Person Engineering was quite a bit cheaper, at a better price, and a delivery time of the building. We knew at that time, I mentioned it at the meeting, that the only thing we would need would be a foundation design for those buildings. Basically, that's a footer and a pier design based on the metal building structure that we'd have to do. We knew that we'd have to do this after we bought. We couldn't do it before because we need the design information from the building. So I went out and got the 3 proposals, and as you can see, Person Engineering for both sites, and it gives a description as 2,200. The other, Colossal, which actually works over at the school, is really close at 25. And second page, you'll see I highlighted the cost of that. And then the last page, SKA, quite a bit higher, and that should be on the last page. They're a larger company, and they're at 7,000. So I would ask the board, unless they need time to go over these, to make a decision on awarding the footer structural engineer contract for the building.
What's your recommendation?
My recommendation would be with Person. Talking with all 3 companies, this is more of a small organization. It fits in within the budget of what we put out for these facilities, and we'll get the same details and plans and structural engineering design that we'll have for metal buildings for our concrete contractor to do the work.
So we're expecting delivery on those
Mid to late September.
so next month. Anybody have questions, comments? Go ahead with BE. It's $300. I'm cheaper than the other guy. Motion.
Thank you. And with that, I think that's all I have. The old business, before we talk about close. Anything else from the organization?
I want to say to everybody, it's one of the ones I should have said, but I hope y'all know that we do appreciate everything that y'all do. It's been difficult, 18, 19 months to say the least. I'm thankful, Larry, that we do that. He does what we do willing to come out. We see nurses on the news all the time, but all those patients getting to those hospitals are put on a truck. And some dedicated people are out there making sure that they do get that. And I know that each of us, I don't have any problem speaking for all of us, that we do appreciate that. It's, the people up to communications, it's a stressful job, so I think we all want to do something with these ARPA funds to help everybody out as much as we can. And I think we will do that, but we do need a little time to digest everything and do the best that we can, because it's a one-time opportunity. And I want us to do it right and make sure we take care of the people that we need to take care of. Is that it? You know, that's it. That's the closed session.
I think we do have a couple things to close.
All right, we'll go into closed session. We're entertaining a motion for closed session.
Thank you for being
here. -318-11A156. Provision for confidential information contract personnel, and let's take a 5-minute break.